Hello, my name is Dr. Daniel Appel, and today we're going to spend some time talking about dental fillings. So I've had a number of questions recently. What are dental fillings? What's the process? When do I need one? So we're going to try and answer some of those questions for you. So the first question would be, what is a dental filling? So a dental filling is a durable material that we use to replace diseased or missing tooth structure, and also to seal the bacteria out so they can't cause further problems. Can dental fillings be avoided? Yes, for the most part, with really good home care. Most of the areas that we end up having to restore for people have to do with lack of adequate home care or trauma or both. So yes, most of that can be avoided if we're really careful with our home care, if we're really careful not to do things like chewing on ice, chewing on hard candies, chewing on rocks, anything like that that would traumatize the teeth. Yes, we can avoid a lot of fillings if we put in a lot of quality time with our home care, with our cleaning, and if we avoid doing those things we already know we're not supposed to be doing with our teeth. No opening beer bottles with your front teeth, please. So a great question people have asked a few times recently, is there any way that we can place dental fillings without having to use a drill? We hate the sound. Well, we hate the sound too. We wish there was a much better method. Unfortunately, right now, drills are still the best method. There were some early promising potential with lasers, but there are really a lot of setbacks with lasers. So at this point, the best method for fixing people's teeth reliably is to still use a drill. But I promise you, the moment something better comes along, I will be first in line. What are the main types of fillings? There are two fillings that are primarily used throughout most of the world at this point. The first and the best is called composite. It's a tooth-colored or white filling material that is chemically bonded to your tooth structure and has a lot of big advantages over other types of filling material. The second type of filling material that most of us are probably aware of from our childhood would be silver fillings or amalgam fillings. These did really well in very small areas of damage, but people started using them in much larger and larger and larger applications than they were ever really designed for. And now we've inherited a lot of teeth that are fractured and broken. And also based on concerns, it's really not used that much throughout most of the world. So at this point, tooth-colored composite fillings are the primary type of filling that most offices place. Can my dental fillings match the color of my teeth? Absolutely. And that's some of the funnest stuff in dentistry, is finding a way to blend that filling in perfectly with your teeth so that it's not noticeable. We all have a lot of color variation in each of our teeth and then throughout the mouth. So fortunately, we have lots of different colors and translucencies of materials that we can use to create a really beautiful result. Of course, a very important question is, does the process of a dental filling hurt? Dental procedures, including fillings, should not hurt. If you are having pain, you should raise your hand. You should let your dental team know. If they don't stop immediately and start trying different methods to make sure that you are comfortable, then you need a new dental team. It's really that simple. There are so many different ways that we can try and improve people's experience. If somebody is having a hard time, there's no reason why the team shouldn't stop and find a way to improve their experience. We can make it a comfortable and positive experience so that people are comfortable coming back and continuing to improve their health. Can I brush my teeth after getting a dental filling? Absolutely, please do. Floss and brush away. That's what we want. You do need to be careful right after the appointment not to chew on anything, because obviously there's a lot that's still numb in there. So we want you to use a liquid diet for a couple of hours until you can feel everything again. We really don't want you chewing on yourself. So no chewing until you can feel everything in there really, really well. Do dental fillings need to be replaced? Occasionally, they do need some help, yes. Nothing lasts forever, and we spend a lot of time every day beating the out of our teeth. So occasionally, yes, they need a little bit of help. The most common reasons why I see fillings needing to be replaced would be, number one, not taking good care of them at home, not flossing and brushing enough, and then we get new cavities. Number two, trauma. Number three, fillings that were way too large when they were placed originally. The tooth never had a chance of holding together. Number 4, chewing on things that we shouldn't be chewing on, like ice, hard candy, rocks. I don't know. Teeth are not made of metal. Don't treat them like they are. Be nice to them. And then the last reason would be a lack of a night guard. We all tend to clench and grind a lot while we're asleep. We're usually completely unaware of it, but that's how our body relieves a lot of stress. And over time, that really strong clenching and grinding will lead to the accumulation of a lot of cracks and fractures that allow the bacteria past the armor of the tooth, and then we're into restoring those problems. So your dentist can make what's called a night guard to help protect your teeth and transfer most of that stress to the plastic instead of your tooth structure. But those would be the main reasons we usually see people needing to have fillings replaced. So another good question, of course, is how much does a filling cost? Good question. It's a hard question to answer though, because many times people will kind of self-assess at home like, oh, I just need a filling, and they'll call and say, what's the price? But in reality, they need something much different than what they may think they need. You really need to have a dentist take a look in your mouth, take an x-ray, see what's actually going on. You can kind of assume if you're right and it is just a filling that you need, somewhere between $300 to $400 a tooth would be a decent ballpark. But I would caution you against setting that too firmly in your mind until a dentist has a chance to do an actual exam and find out what's actually going on with the teeth. Teeth tend to be horrible reporters most of the time, and people can have huge problems with no prior sensation that something's wrong. So if you think you have a problem, let somebody check it out for you and give you the real information. An additional question would be, well, if I think I have a problem, how soon should I get in? And the answer is as fast as it works for your life. Dental problems never get less expensive. They never get better on their own. It always gets worse and more expensive with time. How fast? Who knows? But it will get worse and it will get more expensive. So get in as soon as you can. So if you feel that you have some dental treatment needs and you are in the Oroville area, I and my team would love to serve you. That's Daniel Appel, DDS, at 530-533-7545. If you are not in the Oroville area and you need a new dentist, I would strongly recommend going to Google reviews and looking through what people actually write in the reviews. You're looking for a couple of clues to the office's culture. You're looking to determine if they are good at communicating. Do they focus on the patients having a really good experience? Are they kind? Many clues like that will give you a very good idea about what the office culture is like and what you can expect to be treated as a patient. I hope I answered your questions. Have a great day.